Do you have platysmal bands? Well, first of all, what are platysmal bands and how do you know if you have them? Well, platysmal bands basically are these bands of muscle and sometimes loose skin that we can get in our neck. So let me show you a picture of it here. So as you can see in the center of your neck, there's this little band that is drooping, and this is technically the platysma. Now, the platysma is a sheet-like muscle that comes up the neck, over the jawline, and into our lower face. And this muscle kind of runs underneath the skin. So technically it's skin, then you have subcutaneous fat, and then you have your platysma. And once again, unlike a big thick muscle like, let's say, your biceps, this is a very thin, flat muscle that runs kind of like the skin all the way up into the lower cheek area. Now, when this muscle gets loose, and it happens to pretty much all of us as we get older, and in some people it's genetic, it's kind of loose starting out, even when people are in their teens. When it gets loose, it can create these little bands, especially visible in people who have very thin necks. So you may find if you're a bit older and you've got a bunch of friends that are a bit on the older side and they have very thin necks, you may see some of your friends as they talk, these little bands moving, and those are technically platysmal bands. So they're caused by loose muscle. So how do you treat it? Well, there's a very simple way you can treat these bands, and basically it's just injecting Botox into them. So if your skin overall is fairly tight, but you've got this band or a couple of bands that are just drooping, then by injecting Botox to them, you can smooth those bands out. It lasts about 3 to 4 months, and typically we inject about 10 units on average into each band. Just multiple, a little every 1 centimeter or so we inject it into the band, a total of about 10 units for each band. Lasts about 3 to 4 months to kind of relax the band and cause the neck to look smoother afterwards. Now, this doesn't work though if you've got loose skin. So if you've got looseness and things are hanging and you inject Botox there, it's probably not going to do a whole lot for you. But if you're relatively younger, your skin's pretty good, or if you've had a facelift and a neck lift before, and you just have a band or two that's drooping, then Botox could be a very reasonable option for you. Otherwise, if the skin is loose with it, then Botox isn't going to work, and you have to consider something more aggressive, like a lower facelift. So when platysmal bands are combined with laxity or looseness of the skin, then Botox won't do it, and you actually have to do a lower facelift to actually remove the extra skin. In those situations, what we do is we take that platysma muscle and kind of like a hammock that has gotten loose, we tighten it up from the side. Okay, I'm not sure if this helps you how I'm drawing it, but I'm showing you on my hands. But like a hammock that has gotten loose, we tighten it up from the sides by suturing it on the inside. Okay, and that's how we treat platysmal bands with a lower facelift. And it can work really well to improve the bands. You can see in this picture that patient who has platysmal bands. She's a little bit older. She has some jowling and some loose skin. We do a lower facelift, which includes that upper neck, and can really, really help. Another example of a patient, she's got those platysmal bands. We do a lower facelift, and it can really help to tighten everything up. Now, if you're interested, if you say, hey, look, my issue is that I've got platysmal bands, but I've got a lot of looseness with it, or a significant amount, enough. Let's say you're in your late 40s or older. Sometimes it's more like mid 50s. So when you're in your mid 40s and mid 50s, it's a everybody's a little different in how much aging they have. But really, once you hit mid 50s and older, we typically have enough looseness there that just injecting Botox isn't going to do it. But if that's the case, then you want to consider a lower facelift. Now, I do have much more information on the lower facelift. If you look on this section for lower face, and you look for lax skin of the neck, so loose neck skin, I describe the lower facelift in great detail. You can also look at this section for jowls as well, where I cover that same information. But suffice it to say, platysmal bands, if you're a bit younger, your 20s, your 30s, your 40s, if you've had a facelift before and you've got some of those platysmal bands, then Botox may be a good option for you just to smooth them out. However, if you are in your mid 50s or older, and you've got a lot of loose skin with it, then really Botox isn't going to do it, and you got to look at a lower facelift. You may also ask, well, what about ultherapy or laser treatments? Will they help with platysmal bands? Unfortunately, no. Those types of treatments are purely skin treatments, and they may tighten up the skin that overlies the band, but they really don't do anything for the underlying muscle. And so this is more of a muscle issue that you either Botox it or you tighten it up with a facelift. So I hope this has been helpful for you in educating yourself on how to treat platysmal bands. We do have a couple of options, but unfortunately one of them does involve surgery, but that surgery works very well to minimize those bands. I would encourage you, if you want to learn more, once again, go to the section here under lax skin under the neck, loose skin under the neck, or go to the section under jowls where I go into a complete pre-consultation on how a lower facelift works. Thank you for watching.